It's a beautiful day in Chicago, and today's hot topic is Ozempic babies. This is a term that is used to describe unplanned pregnancies occurring while taking weight loss medications like Ozempic, Mounjaro, Wegovy. There have been numerous anecdotal reports of pregnancies while taking those medications. Media has become quite frantic about concerns because the recommendation is not to take those medications in pregnancy. So the most likely explanation for pregnancies that occur while on those medications is that weight loss by itself will increase the likelihood of ovulation. It's well-known fact by us, reproductive specialists, that obesity, including obesity in polycystic ovarian syndrome, will either eliminate or decrease the likelihood of ovulation, which is obviously a requirement for pregnancy. So simply weight loss may increase the likelihood of ovulation and therefore of pregnancies. A lesser explanation is that these drugs will or may interfere with absorption of oral contraceptives and therefore reduce their effectiveness. So what are the recommendations on patients who are trying to conceive while using the weight loss medication Ozempic and otherwise? The recommendation, of course, is not to try to get pregnant while you're on the medications. However, the concern about significant effects on the baby, or on the mother for that matter, are really have not been proven true. Yes, in animal studies, it does show that medications like that may increase miscarriages and slight increase in birth defects, but in humans, it has not been demonstrated. And a recent study in the British Medical Journal has supported that. So, are there any long-term negative effect or positive effects on the reproductive system in men or women? In men who are overweight, it's been known that sperm issues are significant, and therefore weight loss may improve sperm performance. In women, as I just mentioned, it may increase the likelihood of ovulation. Now, again, we caution that there is not enough data on those medications and their effect on the baby, or the mother for that matter, and so we need to still stick to the line of it's not recommended in pregnancy. However, if you are pregnant while on those medications, just stop the medication, but you do not need to change any directions regarding that pregnancy. The concern for birth defects and all that has been unfounded. So a new scare/concern, but really talk to your physician about it, but do not panic.